I'm Dr. Mike Milligan. We're here at Dr. Woody Oak's meeting, Excellence in Dentistry in Sandestin, Florida, and you meet so many interesting people, dentists, speakers, etc. Just come if you haven't been to one of these. You'll learn so much. One of the people that I've met here is Dr. Steve Roth, practices in Midtown Manhattan. Steve, thanks so much for being with us.
Thanks for having me.
So we're going to talk about Steve's practice because it's pretty incredible. A lot of us can't do what you do in Manhattan. But anyway, let's talk about cosmetic dentistry. You've got the company Cosmalite showing dentists around the country some of the things you're doing for the different movie stars and athletes and some of the people in Manhattan, CEOs of major corporations. Anyway, this is a lot of fun. Tell us about your practice, how you got started, what you're doing now, and some of the people, if you can, that you're treating. Some of that type of thing.
Well, when I got out of dental school, I decided to move back to New York City because I had gone to college there and I was still single. And there's no better place to be in the world when you're single than New York City.
All right.
I ended up staying there and practicing there because I've always found it really interesting to not just work on families, but to get some bigger cases and big cosmetic cases for people that maybe are a little bit transient. They're only there for a few years and they think I have to go to the New York dentist.
Right. And you enjoy the cosmetic
I love it. To me, the bigger the case, the more fun it is. The bigger the challenge to change people's lives with their smiles has always been a big thing to me. However, I've also always been interested in doing it the right way. You know, I started out with Dawson.
Well, I so much appreciate you saying that.
I started out with Dawson and Frank Spear and John Coyce and Bill Strupp, and that's who I learned from. And you know, I've always loved learning from the masters. That my goal has always been to try to be a master.
Right.
And I think that's what makes you happy. If you do things the right way.
You bet.
So I developed my practice.
It's about helping other people.
Absolutely. And I've always, my message to patients has always been, I want to make you gorgeous, but we're going to do it the right way.
Good.
Okay. If it's ortho, we're doing ortho. If it's perio first, you're doing perio.
Okay.
It's, you know, do it the right way.
Foundation up. Okay, so tell us about your practice now.
Well, my practice is in Midtown Manhattan. We're about 2 blocks from Bloomingdale's.
Okay.
And we've been very fortunate to kind of build up a little bit of an international reputation, and we get referrals from all over the world. We get to do lots of models and actresses and athletes. Let's face it, they do live in New York City.
Right.
And marketing and doing your PR work to try to get them in is a challenge because there are other dentists that are trying to do the same thing. But if you just keep at it, like diet and exercise, eventually you get results.
And then you get the networking and the word of mouth referrals from to the other ones.
As we all know, you could do the greatest marketing in the world. The best referral is a personal referral. And that's how we built the practice, mostly word of mouth, personal referral. Now that we're doing a little better, we can actually do some active marketing. But to me, the best referral of all is provisionals. Beautiful set of provisionals, beautiful set of veneers. People want that. They refer the patient in. They want the same thing. We start doing digital photographs of the patient. We let them learn about themselves by looking at themselves. And that's how I developed my product of Cosmalite for the same reason.
Okay, great. Now, how long have you been a dentist?
I've been a dentist. I graduated dental school in 1985.
Okay.
So I've been practicing for about 26, almost 27 years.
Okay, very good. This blew me away. What's the cost of a crown out your way?
I don't know what the average cost is, but in my office, by the time you're done with the crown and the build-up, it's over $3,000.
Over $3,000?
Yeah.
Not in Central Illinois. Okay. You talked about a $100,000 case.
Yeah.
Well, tell me about a $100,000 case.
Well, we have an in-house periodontist who does all of our implants. He's a board-certified periodontist. So there are some people who want to get stuff like this done in a very short period of time because they live out of town or they're busy executives and they don't have a schedule. So they might come in and do 28 teeth in 2 visits or 4 visits or get a whole bunch of implants done and basically make 3 trips to us and have it all done and done the right way. And we take our time.
Absolutely.
It's just doing a lot of work all at once.
Yeah.
I've had patients who've come to me from, I do some radio spots where I'll be interviewed on a talk show. And they hear the radio show driving through New York. They're from New Hampshire and they come in and say, I want a full makeover. Let's go.
Okay, And those are just numbers. It's all about
just
helping
numbers.
the people.
Absolutely.
Those are just numbers, and it's the area, and it's the comprehensiveness of all your previous training that you put to use. But those are numbers that just are kind of shocking
Well, you know
many
what?
of us.
But I've had shocking reactions to other people's numbers and other people's businesses.
Yeah.
And when I was a young dentist, I would hear about this guy doing this. And to me, it's a motivator.
Yeah.
I'm not looking to rip people off. I'm looking to
Not
do
at
great
all.
work,
No.
use the best lab,
Yeah, you bet.
take my time, have the best staff, have the best technology, have the AccuCams and the Digidocs and the Dexis. You have to pay for those things.
Oh, you do. So, okay, so we're helping other people, but those are just some fun numbers that many of us dentists out there don't hear today. What else can you tell us about your practice? You're mainly cosmetic dentistry.
Yes.
Do you do some composites on molars? I mean, what?
You know what? We do a little bit of everything.
You don't do any endo, probably.
I don't do any endo.
Okay.
I refer it all out.
Yeah.
I like to do what I enjoy doing.
And that is mainly your cosmetic case?
Cosmetic, reconstructive, implant dentistry. But sure, we have 14-year-old kids that get composites. We don't see any children, really. We really don't.
Yeah.
But I'm a mentor at Spear Education Group out in Scottsdale, Arizona, and to me,
wonderful facility
great.
out there. It's just a fantastic. We've got another video about that on our site.
Right, and to me, to build a great practice, it all starts with your exam. And if you want to learn how to do a great exam, that's the place to do it.
Yeah.
Okay, that opened my eyes.
Yeah. How long ago
Unbelievably.
did you go through Spear?
Well, I started seeing Frank late 80s.
Okay.
And I've been out there for a few years, but I've also seen him through the years, and I've learned so much about diagnosing. And if you can't diagnose it, you can't
treat it.
get a patient to do it, you can't sell it, you can't treat it.
You got to see it too.
Right.
And I've got my loops with 5 power now.
Yeah.
Love them because you can't treat or diagnose what you can't see.
Right. And to me, if you provide a high quality exam, even if you gave it away for free, it's the best thing you could ever do,
come back to you.
because every patient will say to me, you know something, that was the best exam I've ever had. You must know what you're doing. One of the new things that we're doing now is I like to shut the lights off in the room, always keep a dental assistant in there, and take out the AccuCam and do the video tour when I first meet the patient. Okay, and it's almost like you're doing a little
experience.
It's a little experience, and then they sit up and we turn the lights on and they go, wow, I can't believe what I just saw. And then I learned this from Frank Spear. We take 6 digital photographs on any patient that walks through our door. We put them in a little album and we give it to them to take home. And guess what? They call you and tell you what dentistry needs to be done.
Well, absolutely. We put the monitor right there, right in front of them, a big old monitor with digital x-rays, digital photos, or intraoral camera photos, and they can see it just as well as you can.
Exactly.
It's a whole different way.
Exactly. Yeah. I mean, one of the other things that I've learned is if the patient's not asking for the treatment, they don't want the treatment, or they're not ready for the treatment. And you have to learn how to hold yourself back a little bit, because we're all so excited and passionate. We want to do everything on everybody. But if they don't understand the problem and they don't own the problem, they don't want the answer. So hold yourself back. You actually end up doing better.
Super. Absolutely. So what else would you like to tell us before we close here?
Well, thank you for having me, first of all.
Absolutely.
I'd love people to take a look at my website, www.cosmalite.com. You're welcome to look at our practice website also. That's smilesny.com, SMILESNY. And we built a pretty nice website there. It markets a lot to the neighborhood, and we get a lot of patients from that. And other than that, I just, I love associating myself with people that are into promoting great dentistry. So it sounds like you're one of those guys, so thanks.
Well, thank you so much for being with us, Steve.
Thanks a lot.